My name is Logan Carroll. I'm 25 years old and I was born and raised in Ottawa. My struggle with substance use started at a young age. I was about 12 years old when it started. I started using opiates by the age of 16. It started with a simple procedure. I went in to get my wisdom teeth taken out, and that escalated for the next 10 years. It started with codeine, T3s, turned into Percocets turned into hydromorphone turned into fentanyl, and fentanyl turned into heroin. So drug abuse and substance use disorder took over my personal life in a very difficult way. It started as something that was fun, it was social. When I started really heavily using, when I was roughly about 19, I became an IV user, and I was dating a girl, a really nice girl, that fell prey to my addiction, and I took advantage of her financially and otherwise. It was my first indicator that addiction had taken over my life in a way that nobody mattered other than me. I couldn't stop even if I wanted to. I was physically dependent on these drugs, and that's how I got through the day. That's how I coped. I coped with my mental health by using drugs, and it worked for a long time, but at a certain point came along where it stopped working. So I came into recovery in October 2016, and I chose to try abstinence-based recovery, in which I used absolutely no drugs or alcohol whatsoever, and I was sober for about 10 months. And when I relapsed on a hybrid between heroin and fentanyl, synthetic fentanyl. I did about 0.2 of a gram, and I overdosed bad enough that I needed revival. I needed CPR from my girlfriend at the time. She called the ambulance. She gave me 2 Narcans, or naloxone kits, followed up by another 2 naloxone kits from the ambulance, and an epinephrine shot. I was perfectly content living the life I was living at that point, because it seemed a lot more realistic to continue living that than to quit drugs in the first place, because my mind had got so twisted that I didn't think I could come back for it. It seemed easier to continue to live the life I was living than get better. But once I got a taste of recovery in 2016, I realized that I didn't need to live like that, and there was a much better way to live. What advice would I give somebody who's searching for help? For me, I had a hard time asking for help. I had a hard time admitting that there was an issue. If I was to say anything, it would be to reach out to somebody, start with somebody, talk about it with somebody. A big part of what I do is connectivity. Get connected to the people around you, because there's people in the world that do love you, and it took me a long time to figure that out.